Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I myself, Dr. Kumar Vasani, I am working as a consultant neurosurgeon at Hospital, Rajkot from past 4 years. Before that, I was a consultant neurosurgeon at Fortis Hospital, Bangalore.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So basically, normally any activities of the brain is carried out by neurotransmitters that are the chemicals inside the brain, which actually gets released as we give some or other commands. Now, when the brain is overloaded with these electrical impulses, all of a sudden in a large quantity, then the muscle gets confused. So because of continuous electrical activities, they start either seizing or they start moving, and they starts freezing otherwise. So patient can become confused, patient can get fear, panic, they suddenly froze, they might have sudden staring look like this, they keep looking at it but they don't understand, so they lose the awareness in the surrounding. So this is, we usually call it as a seizure.
What is epilepsy?
So epilepsy is a medical condition where you get repeated seizures. Single episode of seizure is not an epilepsy, but if the episodes of seizure keeps coming again and again despite of medical without any intervention, then we consider it as a epilepsy. So seizure is not a disease, but epilepsy is a disease.
What are the different types of seizures and do they affect people differently?
Yeah, so a good question. Actually, there are multiple types of seizure. When it involves the entire brain, so the whole body is involved. We call it as a generalized seizure because it involves the whole body generally. And another part is a localized seizure or a focal seizure, where which involves very specific part of the brain, and we can actually identify a pattern of electrical activities inside the brain based on the involvement of the organ. Say sometimes it involves one part of the body and gradually it comes upward, involves the lower limb, then upper limb, and then face, like that. So we know that the how seizure is marching. So we can actually, based on this generalized seizure or focal seizure, we can actually diagnose the pattern of the seizure or an epilepsy.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So if we see, majority of the cases where the seizure are unknown, we call it as an idiopathic epilepsy. But there are known causes as well. Like sometimes there are vascular malformations. It means where the blood vessels of the brain which are not linked properly. So they can cause hypoxia. Sometimes the stroke can cause, the brain tumors can cause seizures. Like that, there are multiple causes of seizure, but majority of the cases where we don't find the actual cause, we call it as an idiopathic.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So whenever a patient is having, say, sudden staring look, patient gets panicked suddenly, or patient has kind of aura where he smells something bad, like butter or something, rotten butter, or some amount of smell, or they might have some visual hallucinations where the person is seeing something but which is not there in front of him, but he describes that I am seeing something, and then suddenly they become unconscious or they become unresponsive. So if the person starts convulsing, like he's moving irregularly or irrhythmically, or without his in voluntarily, basically, so then these are the signs where we see that the person is having actually some amount of convulsion. So if the patient is having jerky movement, or patient has just tonic movement, he starts squeezing his hands, his one side of the body, he becomes stiff, right, without responding anything. So these are the signs where we should look for that the person is having episode of seizure.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, it's very unfortunate in our scenario where that epilepsy, or sometimes Hindi they call it as mirki. So there are multiple myths if you see around the seizure disorder, because people feel that if this person is having this kind of disease may not be helpful in my family, or people try to avoid these people. They try to kind of neglect these people. So they feel that this is not a disease, this is something bad, some evil spirit is entering inside. So that's why epilepsy is it's in long term it is misunderstood.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, so once the person is diagnosed with epilepsy, one thing which they should be very cautious about is medicine on time. So we basically we recommend, once you start one brand, don't switch the medicine itself, because many a times changing the brand can also have an conflict in the concentration of the drug. We have seen many a times that we have prescribed some drug and then the person goes to the generic stores and get the routine medicine, and then patient starts having convulsion, and then you have to go back to the same medicine. So we usually tell them that don't miss the medicine. Second thing is, don't miss your sleep. Sleep for 8 hours a day without fail, and your night sleep should be adequate at any cost. Avoid the high stress level, avoid missing meals, don't keep fasting, because the fasting again itself, it stimulates the brain. Then make sure that when you have a seizure, when you have fever or any kind of illness, then you should actually consult, and you should be very cautious, because these are the periods where the brain has very low threshold for developing a seizure. So yeah, these are the things we should actually be very cautious about it.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
So many times I have seen people who actually put the fingers in the mouth, or they put something, some spoon or something, that will actually injure the seizing patient. So and if somebody tries to put their fingers to avoid this biting and all, they actually hurt the person caregivers hands and all. So the best thing is, whenever the patient has having seizure, for example, just turn him to one side. This is the best thing you can do, and make sure that patient is breathing well. So you hold the jaw and lift the jaw up slightly. Just lifting the jaw and turning the patient to one side is the greatest help in any epilepsy patient we can do. So other thing, suppose say person is not getting sleep properly. Okay, so then you should be very cautious, because these are the times where people get seizure. So do not try to taper the dose during those time. Even those people who are taking regular medicine, they should be extremely cautious that they don't put on the weight, because their weight gain also affect the dosage of the drugs. And sometimes because of overweight, their dose may become insufficient and they can convulse. So make sure that they keep maintaining their health, they keep watch on their weights. They should avoid extreme sports, like where they have high velocity, like football, soccer, or they have running and all. So where they feel injury is high, like boxing or swimming, so these kind of sports they should avoid. So these are the things which is very essential in one's life. And another thing is balanced meal is very very important. And sleep, I encourage people to take enough sleep. So that is again a very important thing.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
Before going, I just want to give
Yeah.
one last understanding.
Yes, sir.
Anything people says that yoga is very helpful for reducing the health issues, reducing the stress and all. But remember, when you do yoga and when you are breathing very fast, okay, so breathing very fast, exhaling very fast, inhaling very fast is not good for the brain, because it actually kind of change the structural neurochemical changes inside the brain happens very fast because of loss of carbon dioxide. So in those people, I strongly recommend that you should do yoga under the supervision, because it reduces the stress, it reduces the chance of epilepsy. But if you don't do under supervision, it may actually precipitate the seizure as well. So when you are trying to
Okay.
change your lifestyle, when you are trying to change your habits, okay, so make sure that you are
Yes.
always under constant supervision of some or other healthcare practitioners.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.